So avoiding and preventing MS damage before people have really developed significant MS changes is something that people are thinking about increasingly. It's quite tricky. We know there's been a couple of trials of using DMTs really early in MS, so at the point when people have just got MRI changes without clinical symptoms, and those seem to be positive. But within the UK, within the NHS, we don't use DMTs in this way. They're not licensed to be used in this way at the moment. So that's not really an option today now, although it may be in the future. So instead, it's actually thinking about things that we can do to maybe live a healthy brain lifestyle. So making sure you've had a really good diet, stopping smoking if you do smoke, and not taking up smoking if you don't. Making sure that you're vitamin D replete as well, because vitamin D has been implicated in MS development and ongoing damage. So all of those things are things that people can do on a day-to-day basis that can try and make their brain more resilient or try and prevent some of the MS damage from happening. So it's really hard in an MS consultation, and I think anyone that's been in an MS consultation as a doctor or as a patient knows there's so much to get through. Like, we want to talk about DMT, we want to talk about symptoms, we want to talk about bladder, bowel, pregnancy, the list goes on and on and on. And so sometimes some of that brain health advice gets forgotten and all of those other things. So I think sometimes it's about sort of having consultations that are focused on particular aspects, like what's important to you as a patient from that consultation. Is it thinking about DMT? Is it thinking about other things? And feeling empowered to ask those questions. I think, MS neurologists are very good at listening often, and they really can, take cues from you as a person, and actually sort of having a partnership where you discuss these things and ask those questions. What else can I be doing? Yeah, so this is a question that comes up quite a lot. It comes up quite a lot in my clinic, particularly when people are thinking about having children, because we know that the risk of MS in children of people with MS is slightly higher than in the general population. There's a bit of MS that's genetic, so it makes sense. We don't have any sort of really high quality evidence that says definitely this is what you should do. So instead, the advice is around what the MS risk factors are and how you can reduce those in your children. So we know that MS risk factors appear to be being low in vitamin D, particularly in early life. So actually making sure that your children get a vitamin D supplement. You can buy them as drops, you can buy them as gummies, you can buy them as all kinds of different things, but making sure that they're doing that and getting sort of enough sunlight, playing outside where possible. When they get a bit older, I mean, it's impossible with teenagers to tell teenagers what to do and what not to do, but making sure they understand why it's important that they don't smoke. You can't control your children, but you can try and have that discussion, and they've got sort of an extra reason not to smoke. And also, again, thinking about diet, thinking about exercise, and thinking about all those things that you can do to keep your brain healthy. But I think it's also really important to remember that actually lots of people who get MS may have one risk factor, they may have non-risk factors. It's not all in your control. So, you can do what you can, but you can't do everything.